Good evening, and thank you for joining tonight's live town hall meeting hosted by Douglas County. We know dozens of you are joining already online and on the phone. We're getting some housekeeping done, and we'll get moving soon. Please stay with us. This will be worth your time. So there are more than 97,000 job openings in the Denver metro area. In Douglas County, there are more than 6,000 job openings. Of those openings in Douglas County, nearly more than 1,000 are in healthcare. More than half, 654, are openings for RNs. Tonight, we're going to talk about available careers that are close to home, offer good benefits, and make a difference. We're going to talk about careers in healthcare. First, I want to bust a myth. Healthcare has opportunities both with the public and behind the scenes. And it's not just for those with medical backgrounds and degrees. In fact, it's more than likely you have some transferable skills. So stay on the line. Let's start this virtual job fair. Commissioner Teal will tell you a bit about the format for tonight's call.
Thank you, Commissioner Layden. Well, I welcome everybody to the town hall this evening. Thank you for those that are here in person, and of course, thank you for everybody joining online. This is a real topic for me tonight. A medical emergency in my family last night. My daughter and I were at the Castle Rock Adventist until 1 p.m. Got a chance to actually kind of go through a lot of what we're talking about, meet people who are traveler nurses that are in our community, working in our community and providing health care here. And for me, obviously, this is something that has a very real personal impact that I hope we end this. Yes, this is about jobs, but it's also about how do we fill that healthcare niche here in our community. We are here tonight live with panelists who can take your questions about career opportunities in healthcare and about getting the training you need. Now, before we begin, I would like to take a moment to tell you about the format for tonight's call. We want this to be very interactive. So if you would like to ask a question, please press *3 on your telephone keypad and you will be transferred to an operator who will take down some basic information. Once the operator notes your information, you will be returned to the call and can listen to the conversation until it's your turn. So press *3 on your keypad to ask a question. We know everyone has a lot of questions, and we will get to those very soon. But first, I would like to turn the call over to my colleague, Commissioner Thomas.
Thank you, Commissioner Teal. You know, I too was at a local hospital last month for a minor medical procedure, and I was really pleasantly surprised because we keep hearing how short the hospitals are, but everybody was very attentive. They were very friendly. It was actually just a really pleasant experience. And so I just want you all to know that if you need to go to a local hospital, don't be worried that they aren't competent and they aren't there to take care of you, because it really was a pleasant experience, if you can believe that. So, as Commissioner Layden noted, we are hosting a virtual job fair. Grab a pen and paper because we'll be discussing lots of opportunities and ways that you can submit a resume as soon as tonight. In the future, we plan to host additional live town hall meetings for other industries, but tonight we have with us some really important people. First of all, Kurt McCarty, who's the CEO of Skyridge Medical Center. Jamie Pearson, Talent Partnership and University Relations Consultant for Centura Health. Lydia McMahon, Lead Workforce of the Future Implementation Specialist for National Workforce Planning and Development for Kaiser Permanente. Eric Dunker, Associate Vice President and Dean for Business, Technology, and Workforce Partnerships at Arapahoe Community College. Stephanie Muffick, a Business Service Manager for Arapahoe Douglas Works. Susie Miller, an Administrator for Arapahoe Douglas Works. And Kelly Folks, Arapahoe Douglas Workforce Director and Arapahoe Douglas Works Division Manager. We will be taking your questions about the opportunities in healthcare in Douglas County. Again, please press *3 to ask a question. And if you would like to participate online, you can visit at douglas.co.us/town hall. Roger?
All right, thank you, Commissioners. Again, as a reminder, press *3 on your telephone keypad, and you will be transferred to an operator who will take down some basic information. And you can also participate online at douglas.co.us/town hall. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until it is your turn. And as our Commissioners noted, we will be talking about healthcare opportunities here in Douglas County and how you can access those opportunities and retraining related opportunities. We'll jump right in now with a question that came in online. Commissioner Thomas?
Thank you, Roger. Let's start with this question that came in online. It's from Janet. She says, we know how tough the pandemic has been on our medical staff. Is the pandemic the main reason for the shortage in healthcare workers, or are there other reasons? Who would like to take that?
This is Kirk McCurdy. I'm happy to start things off. Thank you, first of all, commissioners and everyone, for all the support you've provided to specifically all the healthcare entities and how you've truly led through science and led our county in a way that's very much appreciated. Specific to the question, Janet, thank you for asking this. You know, I think in addition to being the CEO of Skyridge, I'm also a registered nurse, and I think that, you know, the pandemic, like anything else, has attracted people to healthcare. It's also had some people who wanted to go a different direction. I think that when you face some of the consequences that we face from facing COVID and really having 4 or 5 surges of COVID patients, what it does is it forces a lot of people to rethink why they do what they do. And so what I've been excited to see is a big influx of new people that maybe weren't thinking about healthcare, are physicians that are applying to medical school at a higher rate than it's ever happened before. And then same thing with nursing. And so yes, the pandemic has impacted us in many ways, but part of what we're facing as well is just the cycle that goes with any profession, just like healthcare.
Kirk, thank you for that. This is Abe. So it looks like we have another question that came in online. This is from Lori. Lori asks, who can work in the industry? Who would like to take that?
I would love to take that. So, is my microphone on? Okay. So I would like to first thank everyone for letting us be here this evening. Very excited to speak to you about careers in the healthcare field. And Lori, great question. Anyone can work in the healthcare industry. That's the beauty of healthcare, is we do have that clinical side of things, but you can also be people like Kirk, Lydia, and myself who work in a non-clinical setting. Help people either enter the field, run our hospitals. So there are a lot of different opportunities, and it's a field that's inclusive to everyone. And there's something out there for everyone wanting to get involved in healthcare, whether clinical or non-clinical.
Yeah, hi there. This is Lydia McMahon, the implementation specialist for Workforce of the Future at Kaiser Permanente. And we looked at quite a bit of our jobs, and most of them that are, we're really looking for a lot of people right now, they require less than 1 year of college or even a certification. So you don't have to be a registered nurse to get into healthcare, and you definitely don't have to work with patients. We have lots of administrative type roles and customer service, which is definitely one of those transferable skills. If you're already doing call center type work or customer service work out in the public, you could transfer those skills and work in healthcare, which is a great industry to move into for future career growth.
Well, thank you so much to our experts. And again, you know, the reason we're here is because we really want to align with our hospitals, acknowledge the heroic efforts of those that are working on the front lines of healthcare, and identify ways to resolve some of the issues that they're facing. So another question that we got came in online as well. It's from Jessica. Why do you think there are a shortage of workers in the healthcare industry? Who would like to take that?
I would be happy to take that one. I think looking at the healthcare industry as a whole, we anticipated a shortage. Well before the pandemic hit, I think that has sped things up a little bit. And so specifically at Centura, we've been looking at creative ways that we can staff our facilities, ways in which we can help support our employees, whether that's going back to school, helping upskill them in their training, and then increasing the pay for a lot of our positions. And so I definitely think that that shortage is there and it's real, but we've been creatively looking at ways that we can address that for quite some time.
Well, thank you for that. Let's keep the questions coming. Commissioner Thomas?
Thank you. I think Roger might have a phone question for us. Roger?
We do. First phone question is from Xenia. Go ahead, you're live.
Hello. My name is Thompson. Basically,
you know, I hate to cut in, but we've got a terrible connection there. It looks like she wanted to ask, she has a business in Parker and wants to know how, and she's more than willing to work with seniors and disabled that cannot be left alone. How might she access using those skills in this situation? She's interested in doing services for seniors or disabled. How might she find something in that field?
So specifically in healthcare, if she's looking to get involved with seniors, then absolutely, there are plenty of organizations out there. You know, in healthcare, we care for people from all ages across our communities, and so it's absolutely a community that we serve. Kirk and Lydia, anything that you have to add on the phone?
I was just going to share. This is Kirk. I think, you know, a big portion of the people we take care of already are elderly and disabled people, and I think all of our healthcare systems. And I think just entering the healthcare system in pretty much any avenue, you get the opportunity to interact and take care of those folks. And so I would just encourage people to realize, and I'm not sure exactly who said this, but somebody did say this already, and I just reiterate it. You don't have to be a nurse or a doctor to work in healthcare. Our healthcare entities are like little cities, and they have all different types of people doing all different kinds of things. And some require you to have a medical degree, but some don't even require you to have a college degree. And so just inserting yourself in whatever healthcare entity is close by your house or something you're interested in joining, there's lots of opportunities to take care of elderly and disabled folks.
Hi.
Yes. Hi.
Good evening. Hi, good evening. This is Susan Miller with 80 Work. I would also just like to add, I'm from Arapahoe Douglas Works, and we're a workforce center, and we'd love to invite you to one of our career centers, and we can certainly help you with that career exploration and help you research companies that might be a really great fit for you.
Hi, this is Eric from Arapahoe Community College. We have several certifications, many of which you can get in a quick amount of time in an accelerated format. So just like Susie said, we'd love to visit with you, explore your skill set and your interest, and work with you to get you certified in a health field quickly.
Roger, do you have another phone message for us?
Let's go to Heidi next. Heidi, go ahead. You're live.
Just answered by ACC. So I have certifications. I had gotten out of the healthcare industry and gone into IT, but I would be willing to come back on a part-time basis to, help out when there's such a gap. So do you have a method that I could regain my certifications relatively inexpensively and relatively quickly? It sounds like maybe you have some fast-tracking that's possible.
Hi, this is Susie from Arapahoe Douglas Works. You know, we actually have some resources available to support job seekers that are interested in some reskilling or upskilling, and have a variety of programs and can help you research which one would be the best fit for you to get any certifications that you might be needing to re-enter the field.
Yeah, this is Eric from Arapahoe Community College. Depending on the certifications and which field you're in, we can work with you. And many of these certifications, you can you can have a lapse in time, go through some accelerated training, and then you can get recertified. And we're also happy to help you out there.
Yeah. And so crossed over to the emergency room and phlebotomy and all sorts of different lab type technologies and stuff.
So this is Kirk, and I just would like to share. Many times when people leave the profession and they go and do something else, they bring something even more valuable back to healthcare. And so I think you having the paramedic and the IT experience is really good. And sometimes it's easy, and I'm sure Centura does many of the same things that Health One does, but just getting your foot in the door in some even capacity that doesn't require a certification. There's lots of jobs like that, and then taking advantage of things like tuition reimbursement to join our go to finish certifications or to get a different degree. Many times is a great way to just get your foot in the door, do something that doesn't require education or a certification, and then use the tuition reimbursement to continue to advance to whatever is important to you.
All right. Let's go next to questions here online. First, we're going to hear from Dawn. Dawn asks, what is the pay and incentive pay for RNs currently?
Hi, Dawn. Great question. I do think that is specific to each organization. I know here at Centura we are looking at sign-on bonuses for new staff coming in. We're looking at ways that we can invest with our employees who have been with the organization for quite some time. And so there are a lot of different opportunities for our nurses to receive that additional pay if that's something that you're interested in. Kirk and Lydia on the phone, anything that you have to add for your specific organizations?
Yeah, hi, this is Lydia. Kaiser Permanente is a unionized organization, so all of our wages are contractual, and you can actually find any of those online if you are interested in seeing what the wage scales were at lmpartnership.org. And they're also posted on any of the job descriptions available at kaiserpermanentejobs.org.
And this is Kirk, and I would just echo that. Not the unionized, but the all of our jobs are posted with pay. It really is dependent on the specialty you have, and whether you work at night, you work during the day, and whether there's call commitments. But what I would just encourage you to do is just explore the internet, both for all of these entities, and you can see kind of what is out there right now.
Well, I want to thank the panelists. This is like a mosh pit of solutions here. This is phenomenal. Roger, I think we had another online question come in.
Sure. Let's go to a question from Claire. Are hospital systems open to helping nurses return to the bedside, brush up on their skills, longer orientation or residency for experienced RNs?
Yes, so great question. Specifically here at Centura, we have our nurse residency program, and this is for both new grad nurses who are entering the workforce as well as for our experienced nurses. So there is definitely an opportunity for you to come back to the field, brush up on those skills to really, solidify that skill set and be able to take care of patients on your own. So definitely something in place for you with us. Kirk and Lydia, anything you'd like to add?
I would just add, this is Kirk again, I would just add we have that as well. The other programs that are out there and we provide and support is we have different specialty training programs. And so if you're interested in being a surgical nurse, we have what we call a PONI program. It's a perioperative nurse intern, and we'll teach you how to be a nurse in the OR, even though you have a nursing degree. And we have a LADI program that is a labor and delivery internship, and we have the same kind of program in the ER, and we have the same kind of program in lots of different specialties. And so once again, I would encourage you, anyone who's interested, look at our websites, reach out to our human resources departments, and let them help you navigate what you may be interested in.
Well, that's awesome. Thanks, everybody. Commissioner Thomas, I believe you had a couple of questions that came into you.
I think that Roger has an online question that he'd like to ask.
You bet. Before I do that, just a quick reminder, press *3 on your telephone if you'd like to ask a question. We have operators standing by. Let's take a question from Dawn. She asks, where do I upload my resume, or do I send it to each hospital?
Hi, this is Lydia McMahon from Kaiser. You're primarily going to have to upload any resumes online through the hiring site for whatever organization you're looking to work for. And so you'll have to do an electric or a online application and then upload a resume, a cover letter if the job requires such things. And then when you do complete your application and have your resume uploaded, just make sure you're paying close attention to what it says the job is going to be so that you can drop some of those key words into your application to make sure that it picks up on any key experience that you have that would qualify you for that position.
To follow up with that, Lydia is, yes, hit the nail on the head. You will need to submit your resume with each organization's job application. But another opportunity that you have is to go online to various job websites, Glassdoor, Indeed, things like that. And you can often upload your resume there. I know a lot of organizations have people who are looking at resumes online and reaching out to those who might be interested in a new job. That's another avenue that you have to get your resume out there.
So John writes to us and says he's a working parent. Are there programs to support the needs of working parents?
So, John, great question. I know that the child care industry is facing the same struggles that a lot of us in healthcare and various other industries are facing as well, and so there is a shortage. I know here at Centura Health, we are specifically looking into that and ways that we can help support our working parents. It's something we continue to explore and will continue to look into. I know we do have an apprenticeship program here at Centura Health, and part of that partnership allows us to work with our various workforce centers that serve our communities and counties. And there are often opportunities for our employees to work with them for child care support. And so I would encourage you to look at your workforce centers as well. And so anyone from workforce, Susie, anything you have to add with that?
Sure. Yes, this is Susie Miller with Arapahoe Douglas Works. Just to add to that, you summarized that really well. When we are working with participants that are going through a training or apprenticeship program, like you mentioned, oftentimes we can provide a variety of supports to the individuals, including transportation assistance in some cases, and child care support as well to some degree. So we can certainly offer a variety of those supports.
And this is, Lydia, I think the workforce centers are great, and we've partnered with a number of the community colleges on some of the apprentice-type programs here at Kaiser Permanente. And also, I would say, once you're in Kaiser Permanente, there are tons of opportunities to train for new roles, and sometimes that might include time to study or go to school, so it wouldn't take away from your normal child care responsibilities because you'd be able to do some of that training during normal working hours.
So this is Kirk, and I just had one thing to add that's maybe just a little bit different take. You know, I think the great thing about healthcare in general, in most of our systems, in all of our systems, we're 24/7, and so we're always here for people. And so it allows you to, if you have healthcare, if you have child care issues, and it allows you to work at different times. And so if you have a significant other that you're trying to manage, or if you're just trying to need special hours, it makes it a lot easier. I just know personally, when I started out as a nurse, I worked the night shift and my wife worked the day shift. It allowed us not to have daycare. And so those kind of things are definitely available in healthcare, where they're not always available in every career.
Those questions so far. For those who have just joined, good evening, and thank you for joining tonight's town hall and virtual job fair. We certainly have a need in Douglas County, as most counties do have a need right now. And I think what we've heard from our phenomenal experts is that many have left the healthcare industry, maybe due to fatigue, retirement, other reasons. And we're really thankful for the experts and economists, specifically at 80 Works. Stephanie Mufik is here with us. Patrick Hallwell is also a wonderful resource. What we've heard from them is that the real heroes of the pandemic were women. 80% of people that left the workforce during COVID were females that primarily left to care for kids that got sent home during COVID when schools were closed down. So we heard a lot about childcare. I'd like to acknowledge a guest here tonight who I have a lot of respect for, but it's personal to me. It's my wife, Kimberly, who re-entered the workforce and within 1 year got a degree at the Sturm Collaboration Campus that the wonderful Eric Dunker represents, got her CNA license, and is now on the front lines in healthcare at Castle Rock Adventist, dealing with COVID patients. So I love that story, and I hope that opportunity is available for all citizens in Douglas County. We know there's 6,000 job openings in healthcare in Douglas County alone. I believe we have a question on the phone right now.
All right, let's hear from Tamira next. Go ahead. Tamira, are you there? Tamira, you are live.
Oh, hi. Am I supposed to ask my question now? Hello?
Go ahead. Yes, go ahead.
Oh, I'm sorry. I thought it was pre-recorded. I'm sorry. So I just wonder, is there any attention or conversation within Douglas County about increasing the number of seats available for students who are wanting to become doctors? Like, for example, the seats at Rocky Vista. I just know that I have completed all of my prerequisite education and tested, and I just keep getting told from Rocky Vista, for example, it's very competitive. They don't have any seats. But I just wonder, because I know there's probably people like me who would like to be educated and then work in Douglas County, but it's just really difficult, especially with competition from other states, students coming to Colorado.
Hey, this is Eric Dunker from Arapahoe Community College, and I hear you loud and clear that you've already done your prereqs. In terms of, MD licenses in Colorado, you're really talking about the CU Health Sciences Center at Anschutz and Rocky Vista. It's really complicated to get additional MD schools in the state sometimes. So right now, from an MD standpoint, that's kind of where we're at. However, there are a lot of jobs within healthcare, like medical lab technician, mortuary science, that where there are opportunities. So even if you have a bachelor's degree, you can come back and get training at Arapahoe Community College and get your foot back in the door in healthcare. And then ideally, if you want to apply to an MD program, get your application in, keep applying, but you can get direct experience in the healthcare industry. That, to me, would get you a leg up on those competitive application processes.
And this is Kirk. If I can just add a couple of words, we would love to have more slots. We have about 150 residents that are a part of Health One that are sponsored by Skyridge and Rocky Vista, and the interesting fact is that's not the number we don't get to pick. That's the number of slots that the federal government supports. And so, totally agree with the previous comments. Just getting your foot in the door in another healthcare entity. There's lots of positions in hospitals that require advanced degrees, like an MD. That aren't necessarily an MD, but get you on the path, and that experience then helps you compete in some of those slots for medical school.
Great, thank you for that. So just a reminder to everyone, we have about a half an hour left, so there's still a lot of time. If you do have a question, press *3 on your keypad to get in the queue. If you'd like to participate online, you can visit co.us/town hall. And I'm being told we have another question online. Roger?
You bet. Here's a question from Farah. She asked, where can we go online to find out how to start up the process of getting into the healthcare field for the first time?
Hi there, this is Eric Dunker. That's a great question. So there's two really good resources here right now. The Arapahoe Douglas Workforce Center, you can start there, and or you could start with Arapahoe Community College. So if you go to www.arapahoe.edu, look at our programs, you'll see a lot of our health programs. We have a lot of health programs ranging from certified nursing assistant, physical therapy assistant, registered nurse, bachelor's of science in nursing, EMT, EMS, mortuary science, healthcare technology, and we just launched an ophthalmic technician program this fall. So we have a lot of options for you, and we would love for you to connect with us, via online, and our contact information is on there.
This is Susie with Arapahoe Douglas Works, and I would just add to that if you come and visit us, we can offer a variety of assessments that can kind of determine where that best fit might be, and we can also then offer you a variety of resources and one-on-one coaching to really guide you through all of your career exploration.
Thanks, guys. I mean, I think that's one of the things that we keep hearing is, you don't just fill out a form and get your doctor's license that next day. You don't just attend a class and become a nurse. One of the questions that I've received in from Chris is, what are transferable skills? And Stephanie, or maybe Susie, I wonder if you guys could take that for us.
Sure, this is Susie with 80 Works. So what we're really looking at with transferable skills is that we've identified with our work with our industry partners, what sort of skills are really going to make somebody successful in a career or an occupation in healthcare. And so there might be things that even basic digital literacy, as an example, is something that can be transferred throughout a variety of occupations. So we're really looking at assessing the skills that you currently have that would really be a good match for the healthcare industries. We've really been able to map that and identify kind of those top skills that all of these wonderful employers that you're hearing from today are really seeking out. For more information on all of those sorts of resources and ways that we can assist you with identifying what your skills might be and how they might translate into a really successful career in healthcare, you can certainly visit us in person or visit our website at 80works.org.
And to follow up on that, I just want everyone, who is participating in this town hall to know there are so many opportunities for transferable skills into the healthcare field. Thinking off the top of my head, if you work in environmental services and housekeeping, that's a great stepping stone for you to come work in sterile processing and sterilizing equipment that we utilize in our hospitals. And that's just one example. So definitely work with your local workforce, because there are going to be a ton of opportunities for you to learn what skills are transferable and what might be a great avenue for you to pursue.
Okay. Hey, Roger, I believe we have a phone question coming in.
We do. Let's hear from Wilma next. Go ahead.
Thank you so much for taking my call. My grandson graduated from Metropolitan State University in December before COVID shut us down. And he was never able to find a job from graduation until everything got shut down. And his degrees are in finance and marketing. I know that that's part of the office parts or the running of hospitals and things like that. Could he apply? How would he apply with that kind of a major?
Absolutely. So I think it might have been, Kirk or Lydia, if you guys want to take this online, feel free.
Oh, I was just going to say, I noticed there was some finance jobs posted on the Kaiser website not that long ago. There's also different administrative jobs that would put him more on the office side of healthcare, but with the education that he has, he'd definitely qualify for some of those roles. And there's lots of opportunities posted out there at kaiserpermanentejobs.org.
And to follow up on that, I think any healthcare organization, whether it's Kaiser, Health One, or with Centura, most of the job sites are going to have areas for him to filter down jobs further, so he can look into specific departments that might be a better fit for him with his background to narrow down his job search that could be helpful for him as well.
Hi, this is Susie again from 80 Works. I just want to add another great opportunity to consider for him is to visit our website at 80works.org, and we currently have a virtual career fair running for Douglas County, and healthcare is one of the primary industries represented. And by uploading your resume into that virtual career fair, there's opportunities to connect with a lot of a variety of job opportunities that are currently being posted.
Really great questions and answers. Again, if you're listening in, please press *3 on your keypad to get in the queue. We do have some additional questions, and one came in online from Taylor. It sounds a lot like what we've been hearing about, but maybe our experts could help answer this. Have you seen people that have worked in other industries transition into the healthcare industry successfully? If so, what industries come to mind?
Kirk or Lydia, I want to give you guys the opportunity to answer on the phone if you'd like.
So this is Kirk. I feel like I've been talking a lot, but I'll take a stab at it and then hand it back to you. Honestly, it's any profession. Anything is transferable. As I said in the beginning, when you work in a hospital or you work in a healthcare environment, it is like a little city. And so there are people that clean the facility, and there's people that do surgery in the facility, and there's people that are finance people in the facility, and there's IT people, and you get my point. And it's really just figuring out what is important to you and getting a connection within the hospital or looking for jobs online. But pretty much I can't think of a profession or a skill that isn't transferable if you're willing to work at it and try new things.
Hey, this is
definitely.
Eric from...
I think it comes down to skills. There's certain skills that you would need in any industry: customer service, digital fluency, motivation, kind of self-starter, entrepreneurial spirit. So if you have any of those types of critical skills, then you'll be able to succeed in healthcare.
Yeah, this is Eric. Some of our most successful apprentices came with zero medical experience and are thriving. One example is Joe. Joe was laid off right before the pandemic after a sales career of 20 years. He always wanted to go in the medical field. He went into the medical assistant apprenticeship with us in Centura, and he's one of Centura's leading medical assistants on his way to nursing now 3 years later. And he was raising his 2 daughters by himself at the same time.
Thank you, Dr. Dunker. It sounds like we've got a phone question. Roger?
We do. Let's hear from Rebecca. Go ahead, Rebecca.
Hi, I'm a current nurse in one of the hospitals in Douglas County. I've been for a little bit over a year. My concern is the morale on the floors is very low. The ratios continue to go up. What are the CEOs and CNOs going to do to keep us to stay? A lot of us want to leave. We don't have staffing. What's going to happen?
Such a good question. And I just want to acknowledge your experience again. We think you're the heroes on the front lines, and part of the reason why we're here tonight is to hopefully provide some hope, inspire those that are listening to get engaged and uplift you from a morale standpoint and jump into healthcare. For our experts, how can we help with that morale piece?
First off, thank you for your question. I echo what the commissioner said. We hear you, we understand you, we know this is a challenge, especially as we now approach 2 years of this pandemic. And so I know at Centura we are continuing to look at creative ways that we can staff our hospitals and our organizations, what additional jobs and support we can provide, whether that's bringing LPNs in, CNA staff, things like that. And so I know it's tough. We are continuing to look at ways we can invest back into our hospitals, our facilities, our employees, as we continue to grow from this pandemic and help take care of the communities that we serve.
I'm happy. This is Kirk. I'm happy to jump in. I really appreciate that question too. It's something that I struggle with every day. I struggled with it when I started out as a new grad in the ICU, and we didn't have enough staff, and I felt overworked, and it's not even nearly what we're dealing with now with COVID. I guess, I think what we're trying to do, and I think all of the hospitals are trying to do, is honestly just trying to do the best we can with the current situation. People are getting care at a higher level than they ever have, and we have less staff than we ever have. And so doing things like we're doing tonight to try to encourage people to come in here. I think the other thing that we're looking at, and I think all of us are doing this, is we're looking at alternative staffing models in a way that how do you use nurses' aides different, respiratory aides different, how do you create a path for, I think this example was used, but for someone in EDS to become a nurse that could help on the floor, or how do you change the structure of leadership and management in the department so we can provide support. I know an example of something that we've done, and it hasn't fixed everything, but it's added a little bit of help, is we've moved some of our physical therapy assistants into different parts of the hospital where we didn't have that before. And so I think the biggest thing that we're trying to do is we're trying to find more people, and we're trying to listen to our staff of what they need to try to meet their needs. But it's not easy, and it's not solved, and it's not going to be solved soon. This is a long-term problem that is something that we as a healthcare industry are facing. And it's not unique to Colorado, and it's not unique to Douglas County. It's something that's happening all across the country.
Thank you. So I think we have a really good question to follow up the first question we just heard from. Chloe wants to know, how does Arapahoe Douglas Works help people get into the healthcare industry?
This is Susie from AD Works. Great question. So the first thing we do is we have actually funding and financial resources available to support individuals on their career pathways. So the first thing that we're really going to do is offer a variety of one-on-one coaching and counseling so that the individual is aware of all the resources and opportunities available. We have a great, amazing business services team that really goes out and collects information, working alongside with all of the employers. And so that we have real-time information about what is in demand, what skills they're looking for, and then we can kind of go from there. We're a proud partner with Arapahoe Community College and all of the healthcare organizations that you've heard from today. We have a registered apprenticeship program with Centura that we can help individuals earn and learn at the same time. And this is really a great way to get into a career path in healthcare. But we offer a lot of opportunities. You can go onto our website at adworks.org and begin that journey, or give us a call and make an appointment. Come see us. We have a variety of ways that you can interact with us and get you started in that exploration.
Thank you. And I think we have another online or phone call. Roger?
Let's hear from Reed next. Go ahead.
Hi, if you can hear me, my heart broke when I heard a prior call very recently from a current nurse or staff member who was really frustrated and kind of beat up. I'm from the hospitality world. I'm a native Coloradoan, father of 4, living in Douglas County, and I'm available for work, and I have management and hospitality skills, but I'm a motivator and enthusiastic guy, and I would love to support nurses and wanted to thank you for this session tonight. Thanks so much.
Well, thanks so much. That's a great message for us tonight. Roger, I think we got another phone question coming in right now.
Let's hear from Dana. Go ahead.
Thank you so much for giving me the opportunity to speak. I also was listening to the previous nurse. I am an OCN certified RN who left right before COVID hit because I had young kids at home. I loved my job, but the hours were just not conducive to being home. I have spent the last 2 years as a telephonic educational nurse and would love to come back clinical to support my colleagues and friends. But the idea of learning new EMARs and hearing about these increased clinical loads and ratios is quite frankly daunting. What advice do you have for nurses that are really concerned about re-entering the workforce?
Thank you so much for your question, and we love to hear that you're considering re-entering the workforce. I know that here at Centura, and I would assume at all hospitals, we have training in place to ensure that you feel comfortable and competent at the bedside. And so whether that's through our nurse residency programs, I know Kirk spoke to a few programs they have at Health One, we have steps in place to make sure that you have that training in the EMR system. We have the sim labs for you to go through various simulations. And so our teams are very much committed to making sure that we have our staff able to care for our patients. And then additionally, I think you mentioned kind of the concern with the schedule. Again, the great thing about being in healthcare is whether it's PRN, whether it's part-time, whether it's full-time, we have something out there for everyone to fit your schedule. And so there's a lot of flexibility there as well.
So thank you for that. And I just want to reiterate, it sounds like we're getting a lot of great questions, especially those with lived-in experience in healthcare. Is there anything more that our experts want to share about programs to support the needs of working parents?
Hey, this is Eric from Arapahoe Community College. Yes, we have strategically scheduled our courses and programs to be combination of online, daytime, evening, weekend. And so if you got certified, say 10 years ago, and you're looking to get recertified or a different certification, you're going to find a much more flexible cadre of programs and classes through ACC. And we also offer on-the-job apprenticeship programs if you have no prior experience. So from day one, you get paid by Centura Health or Health One. You work 32 hours a week. You get your certification in whether it's MA, medical assistant, medical lab technology, whatever field you want to go in. Then you get certified while you're on the job. Then after you get your certification, you get a pay increase, and then you hopefully stay and upskill and grow with that employer. And I know, like others have said, they have programs then to care for you, to care for your kids, and to support that financially. So we're working really hard with our partners for working parents.
Thank you. So Eric wants to know, what does a workforce center do?
Great question. This is Susie at 80 Works. Really, we are a center where people can come and receive a variety of services, from foundational skill building such as resume prep or mock interviews, to providing you with a variety of labor market information to tell you what sort of careers are in demand and how to connect. And then we also have the ability to connect to a variety of providers and training and educational partners to ensure that you can have the right training and education to get you that next job or start that down a career path. So we can help individuals at any point in the life cycle of their career, whether they're just newly entering the workforce or re-entering the workforce, or looking for a career change altogether. We have a variety of resources to meet any of those needs. We have ability to offer assistance with training, ability to offer other supportive services while you're maybe upskilling or reskilling into a new career pathway.
Got a question that just came in, and Dr. Dunker, I think this one is really for you. It comes from Amy. She's asking, are there scholarships or grants that can help pay for the education?
Great question, and yes, there are many scholarships and grants, both public grants through your workforce center. If you fill out what you call a FAFSA for federal financial aid, you may qualify for a variety of grants that you actually don't have to pay back. We offer subsidized student loans, but also on the private side, in Douglas County, we were benefited by the Sturm Family Foundation of up to $10 million gift for the Sturm Collaboration Campus. A good portion of that is going directly to student scholarships. So if you get into a healthcare program at the Sturm Collaboration Campus, there's a very good likelihood you're going to get a private or public grant or scholarship that will help pay for some, hopefully all, of your schooling.
That's great, Dr. Dunker. Oh, go ahead. Go ahead, Susie.
This is Susie from AD Works. Especially right now, we have a variety of funding sources that can look to support those scholarships or grants in order to ensure successful outcomes. If education, or in the case of on-the-job training, we can set you up with some work experiences that you can get paid in a model where you're learning on the job and you're getting paid for it. So we have a variety of options to support anybody that's looking for training, retraining, upskilling, next skilling opportunities.
Susie, thank you for that. So we're getting a couple of more online questions, and one of which would be for Dr. Dunker. It's from Alexis. She asks, what healthcare training programs are offered at Arapahoe Community College?
Hey there, this is Eric. Yes, well, we have, I explained a little bit earlier, but yeah, we have a variety of healthcare training programs. There are several fast-growing healthcare occupations that are not doctor or nurse in Colorado, and we have most of them to train you. So really, I'll repeat, certified nursing assistant, physical therapy assistant, registered nurse, bachelor's of science in nursing, ophthalmic technician, medical lab technology. You can get your EMT and EMS certification. We're one of the few schools in the Rocky Mountain region that has mortuary science. It's a pretty guaranteed job there, and also healthcare IT. So you can get basically any entry-level position in healthcare. Come to us, arapahoe.edu. We want to work with you to get you there, get your foot in the door.
So as the former coroner in Douglas County, I'm going to say that mortuary science is very important, and there's always a job there, so consider that as well. Roger, do you have a phone call for us?
We do. Let's hear from Nicholas next. Go ahead.
Yeah, I was just kind of wondering what, kind of basically what everybody said, just, you know, what is the possibility right now for entry-level healthcare positions? And
thank you so much for that question. There are lots of opportunities for entry-level positions. Here at Centura specifically, we have a really great apprenticeship program that Eric alluded to earlier, and our apprentice programs take people who may have no experience in the healthcare field, and they're able to earn while they learn. So they're working with us, they are going to school at our community college partners, Arapahoe Community College, Front Range Community College, and then upon completion, they are certified in the field that they pursued, whether that's medical assistant, sterile processing. So there are lots of opportunities out there for you to go back to school at Arapahoe Community College, get that certification, and then join our workforce. But then we also have a lot of entry-level positions that don't require that degree or certification that are non-clinical. So, you know, we talked earlier about those roles in finance, whether you're looking for customer service call center roles. So there's something out there for everyone. So I'd encourage you to go online, visit Centura's website, our job board. Again, I know Kaiser and Health One have that as well. You're able to filter those jobs to find something that you're looking for, and we definitely encourage you to start there.
All right,
yeah,
thank you very much.
And I would just add to that, Kaiser has very similar jobs account administration representatives, couriers, patient registration associates that sit in our clinics, and you just have to have 2 years of work history. You don't necessarily have to have experience working in a healthcare industry. And then once you work at an organization, for Kaiser, we have tuition assistance, but we also have other educational benefits that then you could capitalize on once you're in the company to grow into maybe more of a medical field, like something in medical imaging, being a rad tech or something like that, that would have further career growth opportunities for you.
All right, thank you very much. We're almost to the end of our hour tonight. Be sure to join us for future town halls. Visit douglas.co.us/town hall to sign up and ensure you are notified. Before we conclude tonight's town hall, let's go back and hear from your Douglas County Commissioners for final comments. Commissioner Layden, go ahead.
Thank you, Roger. Well, what an incredible opportunity tonight. I really wanted to thank all of our experts from the hospital associations, from Arapahoe Douglas County Works, from Arapahoe Community College, and all of those listening that are so engaged. I have to tell you, I just have a high degree of gratitude for our frontline healthcare workers that have been fighting hard right there with all of us in the county to ensure better futures for our citizens. I think what we heard tonight is that anyone can get a job in healthcare. Your skill sets are transferable. There are programs right here in Douglas County where you can get training to get recertified or retrain for the job that you want to obtain. Go to your hospital job boards or just Google Arapahoe Douglas Works, and it'll take you right to the AD Works website where you can get contact information, connect with a job of your choice. But part of our graphic tonight is you can do this. From our hospital professionals that they're not really overloaded with COVID patients. We heard information today from our Office of Emergency Management that between November and today we have about 0 to 2 pediatric patients ages 0 to 5. We're hovering between 0 to 2. But the staffing and workforce issue is real. So many in healthcare have left for a variety of reasons. So we're asking that we can all roll up our sleeves and get back into the workforce, particularly in healthcare. But again, I just want to thank all of you for listening online and working with us to help with this current situation. Commissioner Teal?
Thank you very much, Abe. Well, obviously, folks, we started this hour, and I shared with you that healthcare is at the top of my mind just because of a very recent medical emergency in my family. Obviously, what we talked about tonight has a lot more to do than about just healthcare, but it's about putting people in jobs that are doing the right thing here in our community. And I want to take a moment and really thank Dr. Dunker for being here from ACC. I want to thank everybody we have here from AD Works. I think about the investment that when I was on the council for the town of Castle Rock a couple years ago, ACC came in and said, hey, we got this idea to build a collaboration campus right there in Castle Rock. And it was a little controversial, the investment that the town made. It's still a little controversial now. Thank you, Eric. But the bottom line is I really appreciate what AD Works and ACC are doing to build that intellectual infrastructure here in the county so that folks do have these opportunities to get into the healthcare field and be a part of the healthcare solutions here in Douglas County. With that, I'd like to hand it off to my colleague, Commissioner Thomas. Laura, go ahead and take us home.
Thank you, George. So let me just tell you that those of you online don't have the opportunity to see Kelly and Stephanie in the front row. You can just see how enthusiastic they are, and they just want to get every one of you on the call tonight in a job by Monday next week. So reach out to AD Works. You know, I was a state trooper. I was with the State Patrol for 26 years. I spent a lot of time in emergency rooms following up on people involved in car crashes. I got to tell you, I used to tell the people that I saw in the hospital that there's a place in heaven for you. You are an angel. Because they were doing things that I knew I couldn't do, but they were there because they wanted to be there. And I know there's a lot of you online that are in that same boat. You want to do something that has satisfaction. When you go home at the end of the day, you're tired, but you have done something useful and wonderful. So let me just remind you that AD Works has 2 different programs in place to help you find a job. They have a premier virtual event going on 24/7. It started January 1st. It goes until March 31st. So you can go to adworks.org. 24/7, you can connect with employers. So if you're working an afternoon shift and you can't do this till at night, hop on to AD Works and they can help you find a job. They're also going to have their first ever that they are aware of hybrid event on January 26th at the Sturm campus. It's from 9:30 in the morning until noon. So hop on over to the Castle Rock Sturm campus and let this great team at AD Works get you employed somewhere where you will find great satisfaction. Good night and God bless everybody.
All right, thank you. On behalf of Douglas County, we appreciate you joining us. If we didn't get to your question tonight, we invite you to submit any questions on this or any other topic to douglas.co.us/Citizen Connect. You can do that at any time. We hope you will join us again for future town halls. Good night.